Thank you so much, BIC, for giving us this opportunity to talk about what we all think is a very important issue, very topical, and something that, people seem to also have a lot of confusion about. So we decided to have this panel. I have great panelists here. You've seen their bios, so we won't repeat them. I just want to, sort of describe the kind of settings that each of them practice in. And because these are very varied settings. So we have Mahesh, who is a counselor. He's trained from Parivartan. He runs his own organization. And so you will sort of hear from him about the concept of counseling, how is it different from therapy, and what are the kind of situations that clients bring to his therapeutic space. Then we have Poornima Bhola, who is a therapist and a teacher. So she supervises people who are training in psychotherapy. Her clientele is very varied. She works in a public health setting, so works with a range of people coming from different socioeconomic strata, different ages. So it's a very different kind of a profile. She also does a lot of work with college students and young people. And then we, of course, have Rathna Isaac, who's probably one of the best known psychotherapists in Bangalore, and who works in the private setting. And she sees individuals as well as families and couples. So it's a very varied panel, which will add to the richness of what we are going to discuss today, because you will get many perspectives. I am just going to be the sutradhar here and try to tie up things and bring them to some kind of fruition at the end. We will definitely have time for Q&A at probably 7 o'clock. So please keep all your questions ready for us. So I want to sort of start off with question to all the panelists, and this is the same question. I might ask different questions to different people later, but let's start with Mahesh, who's recovering from COVID infection and has kindly agreed to join us. I hope you're feeling better, Mahesh.
Much better. Yeah. Thank you.
Thank you. So, one of the things that we often hear from people is that I went to psychotherapy or I went to a therapist and I was not sure what to expect. And I just knew that I wanted to feel a bit better or that I had some problems I was dealing with. So clients, when they come to you, have their own perception about what therapy should be. But as a psychotherapist or as a counselor, what is your working definition of therapy? What is your working definition of counseling and therapy? Because you come from a different space. So would you like to sort of tell us a little bit about your own concepts about the same?
I keep a very simple idea of what counseling is and what I am able to offer. I think of counseling as a safe space, a place which is non-judgmental, kind of objective, a space where it's not my opinion or my thought, that I'm just holding space for somebody to be able to discover what they're going through, what they are thinking about, how they are thinking about things, what their values are, beliefs are, and in that process to be able to kind of discover what's happening with them, why are they kind of going through any kind of suffering that they are going through, what choices may be possible for them, and how can they cope with any distressing situation a little better. That really is all I offer to people as counseling, and I tell that upfront that this is all I can do, this is my job, and anything more may not necessarily be something that I can help with. Okay, that's my job.
Thanks, Mahesh. And is this something that you sort of, bring up front when you start therapy?
Absolutely. Yeah. It's one of the first conversations that we have is to start with like saying, hey, welcome to our session. I'm Mahesh. What do you know of counseling? And the person says, yeah, I've been to like ABC people. And if I know those people, then I might say, okay, listen, you've gone through the grind, you know what counseling is. But if it's the first time, I will take about 3 to 5 minutes to talk to them about what counseling is, how is it different from psychiatry, how is it different from psychotherapy, and does it really meet what they are looking to address at that time. And also we'll tell them that in case they need any other assistance, like and then I would refer to somebody else. Though that reference to somebody else becomes quite difficult nowadays because nobody seems to have time now to take on new clients.
That's true. Thank you. We'll hold some of those thoughts to sort of come back to you later. So I just want to, flag the same question to you, Poornima, about what is your working definition of psychotherapy?
Well, I think to start with, I think it also depends on what your definition of mental health or well being is. And I think one that really resonates with me is looking back at Sigmund Freud's definition that is the ability to love, to work, and to play. So I think that's a simple definition. That's something that everyone can relate to. And so that becomes a good opening line to really talk to people about what they're looking for. I would agree with Mahesh that therapy is a space. It's meant to be a safe space. It's also, I think, like a meeting space where two people meet, and that human encounter is really the most important. And it's also what I like to call a transitional space, because it's space for uncertainty, where you can bring your contradictory emotions, where you can bring questions that don't have answers, where there's that space to explore. And I think it's also useful to kind of use different metaphors. Like it's a territory in which you co-travel, and the map that you define it together. So I think that kind of sets the stage for a conversation. It also sets the stage for asking, what are you expecting? What are you looking for? Because my definition may not match with what the person brings in with them.
So, you've added another sort of angle to it, and, very nice phrase about being a co-traveler in the journey. So it's almost like giving equal responsibility in some ways to the person who's coming in for help, and not saying, I'm going to be here to handle all your problems or to fix everything, but we're just going to navigate this space together. So, we will expand on that a little bit. And so I'm just going to Rathna with the same question. What is your definition for yourself about psychotherapy?
Yeah, so I can see that the word space is something that we all resonate with, because I would see it as a space to reflect. The common metaphor, the picture for therapy is that of that mixed bag of wool, and the therapist sort of sorts it out and hands it back to you. I would actually feel that the therapist is more like helping the client to sort out their bag of wool, rather than you give it to me, I'll clean it and I'll give it back to you. So it's like a space to sort of gather yourself, all the different bits, all the experiences, all the thoughts, all the feelings, and somewhere to help you make sense of what's happening inside. And I think that would be a large part of what we're doing, regardless of the kind of issue or the kind of difficulty that the client comes with.
Yeah, thanks, Ratna, for that. So I think, each of you have touched upon slightly different parts of the same process. I want to talk a little bit about, this relationship between the client or the patient or whatever terminology you want, and the therapist or the counselor. Clearly, most research, most evidence has shown that this relationship is very important, that what happens between the two people is very important. And I'm just trying to ask you, how do you know that therapy is going well? Like, how do you know your counseling is going well? Is it only when the person says, oh, I'm feeling a lot better? Is that your yardstick, or is it something else in the process? So, Mahesh, would you like to go first?
Yeah, actually, that's a great question because many of my corporate clients keep asking, how do I measure this outcome, or what can I do about it? And most times I tell them that counseling is not something that we can immediately measure. That sometimes what happens in the session can have an impact 2 years later, 3 years later, even 7 years later. A client might come back and say, now what we talked about makes sense, and now I'm able to kind of work on. What we discussed. So it's not always very time bound. in terms of what impact it has or how it makes a difference. For me, success is when the client is able to deepen their understanding of what they are going through and who they are. And it may not necessarily leave them happier. It may actually leave them sometimes sadder in some senses, or like other kind of emotional spaces. But it can certainly leave them with a little bit more awareness of what they are going through, who they are, what they are feeling. And just that much of space, if you are able to open up for a client, I think then then they start to kind of recognize possibilities in life. And when we are able to open up possibilities, I think we have achieved some degree of success.
I think you mentioned two very important things, which I think being in the mental health field, one has often faced that. One is, of course, helping the person understand the situation much better, and the second thing that you mentioned, that sometimes it's like a cascading thing. The change is not evident, or the well-being is not evident immediately, but sometimes a year later, when something happens, there is a aha kind of a feeling that, oh yes, this is what we were talking about in our session, and this, I have a better understanding of what is happening. So the reason I'm raising this is that many people whom I meet sometimes socially would say, I've been in therapy, and if I ask them, how is it making you feel? Well, I can't see any difference, and so I think it's very important what you said, that sometimes it's about what people expect will happen in therapy. So we have, as professionals, a working definition of therapy, but what do people expect? What will happen in therapy? I think that is also something which is important. So I want to ask Poornima, what do you feel? When do you feel that it's that the relationship is sort of, it's something good happening there, and your sort of measure of success to see. And success is a very not the most appropriate term, but that it's going well, it's going in the right direction.
So I thought I'd just say two different things. One is that perhaps I shouldn't be the one measuring the success or how things are going, that it's important to hear it in the client's words and in their experience and in what ways that they express. So that's one thing to try and keep in mind, that we don't have our own list of, measures of success, but look at what the client brings in. And the other thing is that sometimes a feeling that something is going well is when it's difficult. Sometimes when you're stuck, or when things are challenging, or you have gone into another area of uncertainty, that sometimes can be an indicator that really you're venturing into a territory that was not possible, or you've, as Mahesh said, you opened up more possibilities than there were earlier, even though it seems uncertain. So
yeah, so I think what you're saying is that it's not so much the therapist, but what the person says, and that can also change from session to session, where in one session the person is saying, what you told me last time, I realized that, I thought about it, and the next time they probably have not been able to process something, so it does kind of change depending on what you're dealing with. Rathna, I just wanted to ask you a similar question, but a little bit about when are you able to say that, because like we said, that the relationship is very important. After all, what happens in therapy is also reflective of what is happening in the person's life, or what has happened in the person's life. So they think of you as daughter, as mother, as sister, as friend, as boss, or whatever. They will put their, those feelings on you. So the relationship or the transference that happens in a relationship, in the therapeutic relationship, sometimes the key to, understanding things better. Do you sort of see that classical therapeutic stance taking place in your therapy, or is it more here and now kind of work?
I think I would say that it is definitely a mix of both. And I find actually that to try and distinguish between something which is slightly more here and now or immediate, the client says, I'm having a difficulty with this, or I don't know what to do about that. I want some help figuring out how to deal with my child. it is in how you respond to that that the rest of the relationship does evolve. So I don't like to really separate out the two too much. But definitely you can see that, after some time, there's a certain energy that enters the room. And when you feel that energy with the client, you know that, okay, we are connecting and that's always a sign that, okay, things are going somewhat well. And in that connection, very often I find that things we haven't actually spoken about explicitly, the client brings it back sometimes saying that I connected this with that and I made these changes because of what we spoke about over here. Or you can see them just the tightness just relaxing a little bit. And as they get more comfortable with you and you get more comfortable with them, clients get more comfortable with themselves. And for me, that again is a big and important marker that what we're trying to achieve is sort of happening, because ultimately therapy is like, we can't sit in the therapy room and change the external circumstances of anyone's life. A difficult partner, a difficult job, a difficult child, these are things which are going to remain. But your experience of yourself in those relationships is something which can change. And that's, I think, often something significant that happens.
Thanks, Rathna. I think beautifully put. I also want to raise this issue, which, when we were planning this talk, this was a discussion that we had, and this is about sort of the new generation of therapists and the way therapy is being currently practiced. Therapy, when I'm saying therapy, Mahesh, I'm sort of using it, counseling, bar therapy kind of stuff. So I know one of the things that has happened over COVID, I think the pandemic has brought this. First of all, we all learned how to practice online therapy, which we did not know. I mean, that room was so sacrosanct for us when we would do therapy or counseling. But that room sort of expanded onto a very different online space where, many times the client or the patient could actually see where we lived, our, so many things, the books we are reading and everything. So it kind of became very different. But at the same time, now we have a range of therapies available, and also the whole space of social media related therapy. So we have influencers, we have therapists who are out there giving a lot of advice on Instagram. These are people who are seeing clients as well as giving information out there. Many people follow them, and I have found that many people feel they get help by them. There's sort of people who are managing anxiety, there are people who are managing sexual issues, there are people who are managing LGBTQI plus issues. I mean, there's a range of stuff out there in the social media, which is so easily accessible, where you don't have to make an appointment, you don't have to pay. I mean, there's so many things which are involved. So just some reflections on, the sort of the good and the bad and the gray areas of this, so that people in the audience who are going to listen to us are aware of some of these issues. Mahesh, I'll start with you.
I'll take it a little bit more personal in this sense here. Especially for young children who are like, say, what, 12 to 16 or 12 to 18 kind of space, who have grown up absolutely in the social media era. For them, thinking of mental health and other things, they don't think about anything that we are talking about, including the sacrosanctness of the space, or whether it's like, the model of therapy. None of that really matters to them as much as it is here, it is accessible, and it's ready there, right? And when young people are looking at social media and reading about ideas of mental health, etc., many times there is also that internalization of all these ideas, and the conversation that young people are having are interspersed with all kinds of mental health terminology all over the place, and many of them are talking about their mental health, so solidly, and then also the increases the peer pressure of being able to identify your own mental health and talk about whether you have any kind of issue or not, and many children are convinced about that their mental health issues are more odd than other people's, or there's a certain kind of competition even going on in that space. That's also happening a fair bit. But leaving that generation, which is completely the social media generation, and coming a little bit more to the Gen Z, millennial kind of space, where which is still at least about 15, 20 years younger than many of us. For them, again, the therapy has been about like people who've studied therapy coming out of colleges and like making themselves present, making themselves accessible. We see every day on Instagram, advertisements pop up, and people who are like making memes. Some of them make it mental health very accessible, but some of them are also like really scary, right? And a few days back, one friend of mine forwarded a tweet by somebody who was commenting on their therapists, on their ex-therapists, in a self-righteous tweet, calling them out, saying like, "Hey, listen, you made my life miserable by following me on social media. You commented on every tweet I made, and you brought up my tweet into our session. All kinds of boundaries got violated in that process." And so the technology is like, is a tool, but I think it's a tool which has gone wild in many ways. It's really difficult to put the genie back in the box and try to get people back into the counseling room, into traditional, with week on week sessions. Let's move it that way. And there are so many tools which are now saying, okay, we'll automate your journal for you, and all that, which raises up so much fears of where is this data going to go, what's happening to that information, and how will people protect themselves from each other. It's a really scary place for me. And so when people tell me that they are using many of these tools for therapy, I ask them to saying, okay, use it if you need to for in the urgency of your need, but otherwise, please do see if you can meet a therapist. It's everybody's available online now. It's not a dearth of support spaces. But I do see a generational gap coming up between people like us and the social media generation. I don't know if we'll be capable of working with them in another 5 years.
Yeah, I think so. I think when those were very valuable points that you made, and sort of taking on from there, I just want to talk to Rathna a little bit about, the whole process of boundaries. So Mahesh talked about how, because of the therapist's social media presence, in fact, I mean, we sort of traditional teaching is that you don't accept a friend request from your patient or your client. And, so that we have that many boundaries and supposed to be. When should somebody who's seeking therapy or who's gone into therapy be aware that these boundary violations are happening, even from the therapist? So what is it that they should, I mean, the obvious boundary violations of, sexual boundaries and all are very clear, but these subtle boundary violations, when do, what should, first of all, what is wrong with it? And then how does the person become aware, and what are the sort of red flags?
Okay, so I think that is a fairly complex question because it covers so many different kinds of things.
Maybe you can just take one of those.
For clients, in general, clients may sometimes seek closer relationships with therapists. I mean, I have dealt with the social media thing by just not being on social media myself. So, it's easy. Can we be Facebook friends? No, I'm not on Facebook. But I do know that for therapists as well, now, especially for newer therapists, being present on social media is a way of getting attention. It's a way of getting clients. So when I have younger supervisees who are sort of starting out on private practice, they want an Instagram handle, they want a page, they want to show people who they are. As long as that interaction remains at the professional level, I'm speaking about myself as a professional, then it can just be something that's informative. But I think when it crosses into personal, um, you find out also what your therapist is interested in, you find out what else they're doing, even if they are not necessarily putting themselves out there. And then for clients, it can be, and I've seen it having been a bit of a, um, it's, it's actually, I think, quite a difficult experience to think that this person who I thought was just for me is actually someone who shares so many things with so many other people um, out there. So for, I would say, for a client, if you have an experience like this, then it's something which I would suggest you bring up with your therapist. Social media is part of our lives. It's not going to really go away somewhere anytime soon. And both therapists and clients in different ways it want to engage with it. But when you find that that is leading to crossover of personal lives coming into the therapy room, then that is something which you probably need to talk with your therapist about. I'm not sure if I
Yeah,
sort of
I think you
responded.
did. You did.
Yeah.
I think basically you're saying that it is also clients, if they're feeling uncomfortable with all that, information they're getting about the therapist, then it's a good idea to kind of bring it up and say, look, I got all this information. I'm not
Information
feeling
and-
very comfortable,
Yes.
and can we briefly discuss it so that I can,
Yeah.
handle it better? Kind of thing.
Yes.
Yeah.
And
Purnima, I'm just going to take a slightly different tack because I think we kind of covered this, but I know that in your book um, on reflective practice, which is a wonderful book and a must read for all therapists and counselors, um, no conflict of interest here. So, one of the things that the book is very good with is intersectionality. So, I want to talk a little bit about, we talked about the younger generation, the social media generation. I want to talk a little bit about the older generation because, sort of the generation which is in their 60s, 70s, 80s, for them, all this therapy stuff is very new. They have always wanted to be very stoic. I'm not generalizing here, obviously, but wanted to be stoic, wanted to be able to handle things on their own. Family, brothers, sisters, other counselors, to go to somebody else, particularly if it's a male, to go to a younger woman and talk about, their weaknesses or what they're feeling is a challenge. So that's one group, I think, if you can just comment on. And I would also like people to comment a little bit, on the therapies available for people with disabilities. So one is the elderly, and the other is people with disabilities, and what kind of help, therapeutic help for people with hearing impairment, visual impairment, speaking impairments. What is the kind of stuff which is available? Because in our quest to sort of help people, we shouldn't be only looking at the young, articulate prototypes. So can you just any of you can respond to that, but I'll start with Poornima.
Okay, I'll just say a little bit, and so that everybody can add to that. I think we first need to, when we're saying who is therapy for and who is our client, I think intersectionality is very important, because quite often who is your client really differs depending on whether you're looking at age, gender, class, caste, which we don't talk about as much, sexual orientation, whatever it might be, and ability, all of these things. And it's at that unique intersection of all these locations that your client comes to you. And we are also situated at some intersection, right? So I think talking about how to tailor therapy would not just be, even if I'm speaking about an older person, it would be the older person and the intersections of all the other locations. And I think then, so tailoring therapy becomes a very unique thing. Now, all of us sitting here today, we're in an urban setting, but sometimes I wonder, an older person, let's say in rural India, what is the word for therapy actually? I'm not sure in different Indian languages, what is the word for therapy? And is the way we conceptualize therapy meaningful to that? So I think we have so much work to do to even the language that we use, the way that we position the role. Sometimes I have trainees telling me that when it's an older person and they say, you're like my daughter, I just keep quiet because, I know it's important for them to feel that way about me, at least in the beginning. And I because they're also used to that equation. So I think it's really challenging. We need to look at our language. We need to look at which way you develop the relationship and what kind of techniques or approaches make sense, and you cannot just lift it out of a book and apply it. I'm just going to stop here because I know that both of you have more to say.
Yeah, I mean, I was at a very interesting panel yesterday where a young person got up. It was following a play on mental health, and a young person got up and said that she following COVID, her parents were so distraught and upset, and she had sought therapy, and she really wanted her parents to seek therapy, and she said, and you could see the helplessness in her face when she said they were so reluctant. They just said, what can another person help me with? I've seen life. I've done so much. So I think, crossing through all those layers of whatever fear maybe or whatever it is. So Ratna, do you want to sort of, explore that thought a little bit?
We'll start with older people. I think, as you said, very often older people are referred by their younger relatives rather than sort of choosing to do it themselves. In general, though, I have found that those who do come in for therapy, both men and women, really do value the space. And I find, especially with older women, there's almost a sense like, I didn't think I could be understood. I didn't think that this could be okay. And so I think that just crossing that barrier and stepping in makes a big difference. The way in which family members introduce the idea to them, whether it comes like, you have a problem, so you need to sort it out, or whether it comes like, I think you need a little bit more support than you're getting right now. Sometimes the referral is through the primary care physician who's noticed that there is, maybe there is a mood dip along with the other physical health conditions that they're having. So the route of entry, I think, is important. I also feel with older clients to kind of encourage and build the sort of support systems and mechanisms for self-help that they've already developed. Whether it's with a community, whether it's with a religious group or a satsang or whatever feels comfortable for them. I kind of try and make it explicit that all of this is welcome in here. It's not like, here, this is scientific and we're going to talk about some things, and other experiences that you're actually finding meaningful need to be kept out of the door. And I think that inclusiveness is something which really helps them to feel comfortable stepping inside. With disabilities, I've done some work with individuals with physical disability, not so much vision or hearing impairment. And interestingly, it is relationships that they are really wanting to talk about, whether it's sexuality, whether it's I want to get married, and or have these kinds of relationships, and the feeling that there's really no other space where I can say this, because in general the idea is that, okay, if you have a disability, then we look after you, but that's it. You don't need to look for anything beyond that. So I think support in navigating that for the individual is something which I found, to be quite an interesting and rewarding kind of experience.
Thanks, Ratna. I think this was very, very, you touched upon many things. And I like the way you said that with older people, not to say that this is the only thing which is going to help you, but also encouraging them to use all the things that helped them earlier. And maybe that giving them a sense of control when life seems to be going out of control is probably important. And like you said, inviting everybody else, all kinds of things into the therapy space rather than being very rigid about it. Mahesh, would you want to add something about your work? With
Yeah, a couple of things, especially that when we were talking about technology earlier, and I think technology has been great for people with disabilities to access mental health and other things. I have worked with a few people who are hearing impaired and have used closed caption text and other things to help facilitate the process a little bit. Though I usually try and see if I can refer them to a person from within their community, from a person with disability who's also in a mental health practitioner. Very precious few of them around as well. So it's not so many that we have. That is one part of it, and the second is that when we're working with people with disability or people from the queer community or other places, the locus, our locus and their locus matters so much. Like what Poornima was talking about, that intersections come up so much. Especially when working with people with caste and another one like the caste plus disability, it gets quite important for us as therapists to be able to hold that contextual understanding, saying that this is not a you problem, this is a system problem, and that is such an important thing that I keep trying to bring up so much. To give more permission to experience sexuality, to give more permission to kind of just take some risks in life. It's really amazing, and it also makes me feel very conscious that I am temporarily abled, that my ability is not going to last forever, and that is one part of it. The second thing I want to say is that when I meet older people, right, and especially as a cisgendered gay man, I get to meet quite a few people from the LGBT community, and when parents and others who may be older would want to come and meet a counselor, many times I find it that I tell them to meet one of my cisgendered heterosexual colleagues rather than myself, because I tend to then get because people will find out that I'm from the community myself, and that kind of also clashes where I've had parents come and like attack me to say that you are grooming our child, you are doing this, you're doing that. So the intersection matters on both sides. And just to connect back to what you were saying, that is one of the reasons why I chose to be fairly open about my gender, my sexuality, and everything else. I have a relatively open social media presence. So I thought that those things are important for people to know who they're engaging with in terms of these kinds of locuses of caste, class, ability, education, and other things as well. So, yeah.
Yeah, thanks for that, Mahesh. I think, I mean, one of the things, of course, is like you mentioned, using technology to support therapy, but also the challenges that one can face when, you feel that people who are coming to see you may not completely be comfortable with who you are. And particularly if it's older people or, people, I mean, older people are, of course, very open, but, to be open about certain things so that it doesn't hinder the therapeutic process, and be very honest and authentic about it. And I think that is one thing which brings me to the next question, and let's sort of gently segue into therapist characteristics, because I think one of the things that, again, evidence has shown that you may use cognitive behavior therapy, counseling, interpersonal therapy, psychodynamic therapy for the audience. These are all the various kinds of therapy you will see, Jungian therapy, and, several forms of therapy. Ultimately, what seems to be the one which improves outcomes is therapist characteristics. And one of them seems to be, the main one seems to be authenticity, which and the ability to be reflective. So do you want to, Poornima, given the fact that you do a lot of work around reflective practice, would you like to discuss this a little bit?
So I think one of the things about therapy is that if you think of therapy like a pill, then it doesn't matter who's administering it, right? Then it's only the dosage and maybe what color the pill is or whatever else seems relevant. But if you're going to really look at therapy as a human encounter, then if I have to refer somebody for therapy, like suppose a family member is looking out, I'm not looking at the brand of therapy. I'm looking at who's the therapist. Who's the therapist I choose for my family member or my friend. And then I'm definitely looking at various personal qualities. And I think in that sense, some of the early counselors and therapists have said it quite well. They look at important conditions like what empathy you can provide, the positive regard, the authenticity that you have in the space. So really, it's a human encounter. And I think that's the most important thing to remember. Having said that, I think it's really important that you connected with the process of being reflective, because as a therapist, you're using yourself as the instrument, much as a musician may use, I don't know, the piano or the violin. So you have to be quite aware of yourself, right? So what you bring into the room, what are your values? What do you think about, I don't know, the sanctity of marriage or polyamory or, whatever it might be. What is your own history? What do you bring in? What is your motivation for becoming a therapist in the first place? Your own social location. So I think there's a lot of work the therapist. So I think apart from all of these other conditions that you might bring into the room and your empathy and your authenticity, I think a therapist who's willing to work on themselves, to be more aware, to be more reflective, and bring the fruits of that work into the therapy room, I think that's also really, really critical, because you're looking for that human connection, and that's the power of therapy.
So Rathna, taking on what Poornima said, if you have to refer a family member or a dear friend to a therapist, what kind of qualities are you going to look out for?
I think as I was listening to this, the one word which kept reverberating is openness. I would look for a therapist who is open to the client, open to themselves, which is where I think the reflection and the self-awareness comes. And somebody who I feel has competence as well as care, and a balance of both. And yes, I think, it's just 3 little words, but actually it covers a whole lot of things. So someone who is not going to judge, someone whose own emotions are not going to take over and become more important than the client's emotions. And yeah, again, open. Someone who is able to be open, I think, is very important, because ultimately what you want to do is to help a client to open up themselves. And, like Freud said, you can't take anyone further than you have been yourself. And I think that's a very important maxim for me. So I would like a therapist. And maybe, yes, I feel if I can feel relaxed with that person in the room, I'm more likely to refer people with them to them. Whereas if I feel I myself have to be a little stiff and a little careful, then I wouldn't. So, yeah.
Thank you. That's a very good measurement, a good thermometer, I think. So we have, about 15 minutes, a little less than that to go. So I'm going to talk a little bit about, or ask you and, explore the space about cultural issues because it keeps coming up that psychotherapy is something developed in the West and even counseling. It's something which was developed in the West. We have taken it and we are using it in our context. Ours is a very hierarchical society where, children are supposed to be, obey and subservient to their parents. And, it's like a structure. And that is one of the reasons why probably a lot of the at least some kind of psychological advice or whatever or making people feel better happens in ashrams by gurus, and a lot of people look for that kind of very directive. There is a person, usually an older male. uh, if there's a beard, then all the better. But sort of kind of telling you, what, sorry, Mahesh. So, so kind of telling you what to do and helping your family, making decisions. I mean, that's the kind of model that a lot of people work with. And, one of the sort of very senior psychotherapists in the country, Professor Neki, talked about the Guru Chela relationship and how that seems to work in India. So, of course, people feel that may not suit everybody. It may suit some people. So, what do you think of the cultural adaptation of Western models of therapy into, the Indian context, which is a very, very different kind of cultural and family setup? And, with years of practice, what's been your experience?
So I think the first thing which comes to my mind whenever anybody asks, does therapy work for Indian clients and is it different from clients in the West? I want to say I have no idea what happens with clients in the West. But I do know from 20 years of working with clients right here that it is definitely something which works for clients here. Yes, we do have clients coming in and, assumptions of omnipotence or omnipresence on the part of the therapist that you will be able to see me, you will be able to fix me, you will be there for me all the time. These sometimes clients do come in expecting that this is what will happen. And so maybe just to take a little bit of time in the initial sessions to help clients understand, as Poornima said, that it's more of a shared journey. I may not know more than what you know about yourself or about where you ought to go or about what you ought to do. But I'm willing to be here and hold your hand while you're figuring this out for yourself. In general, I find that clients really like that. I mean, on the whole, clients really do value that. Having said that, I think, again, if anybody comes and asks a specific question about a specific problem that they're having, I don't really hesitate to share my opinion, but I do make sure that they know that this is my opinion. This is not some God given fact that, yes, this is how it is and it has to be for everybody. I would say maybe this is how I would see it, but I want to know how you would see it as well in relation to that. And so maybe it's a bit of a combination of the two. And I think more than Indian, Western, I would just look at how much is a person emotionally ready for. So some clients, I think, are more emotionally ready to take their own journeys. Some clients are more hesitant. They want and need perhaps a little more hand holding. And so I think being able to sort of sense where the client is and being willing to go with them. It doesn't really matter then whether you're Indian or Western or wherever, because you are wherever the person in front of you is. And that's what I try to tune into.
Thank you, Ratna. I sort of deviating a little bit from there because I think Ratna has really expressed it very beautifully. Poornima, I just want to talk a little bit about. So there are lots of creative forms of therapy which are available right now. There's drama therapy, there's art therapy, there's dance therapy, and a lot of people feel a bit more comfortable doing those kind of therapies because they're probably either it's more attractive or it's more energizing, um, or talking seems to be very scary because you have to make yourself extremely vulnerable there. What do you think, when should people go in for those therapies? I know you can't give a sort of simple answer, but just giving your reflections on it.
So I think, what should I say? Many roads lead to Rome, sort of thing. So there are many paths that people can go down. I really don't know what to say. What's the right way to begin, or how exactly to decide if someone's thinking of, entering counseling or therapy. They have their own assumptions or their own ideas. I think one really good way to do is to talk to other people to find out what their experience is. Because if you search online, sometimes you get a very frozen image of therapy, which may not be what it's really like. So talking to people about what you can experience, what you might expect, and then sometimes trying it out, because you may enter with a particular idea, even if it's, let's say, a more traditional form of therapy, so to speak. Let's say somebody comes in saying that, I have a fear of flying and of closed spaces, and I want this particular therapeutic approach. But what might happen is that after you use a particular method, then the person says, recognizes that I have lots of fears of intimacy, and I really want to discuss things from my childhood. So then you have to make a turn or a switch, or you have to renegotiate things with your therapist and see where you're going. I also don't think it's an either or, because lots of therapists are integrating more creative and experiential forms into their therapy. So it's not necessary to make, one choice or the other. Having said that, for example, if it's movement-based therapy, then the person really has to be well-trained. I wouldn't be trying to do that. But I would perhaps be able to dip into some of the more creative art expression or grounding, or some forms of therapy that are more, or techniques. So I think it's not two different boxes, but really there's a lot of blending and a lot of shifting from one to the other that I can see people doing now. And I think that's a good thing.
Do you want to sort of come in there? Rathna? Anything to add to that?
I think sometimes words can get in the way, and I mean, I'm a talk therapist, so I know that I actually can't lead anyone in a non-verbal, expressive manner, but there are times where I do feel with clients that we've said everything, we've been through this 3-4 times, they're still feeling stuck. And there's something about the viscerality of experience over there, which I think can sometimes shift things that words can't. So yes, my natural inclination would always be for talk therapy, but if I find with clients that we've gone so far, but we're not able to move further with sexual abuse experiences or trauma, especially childhood trauma, then these are the times where I think of referring to somebody who's doing more embodied work or doing more movement work or doing something which is slightly different from what I do.
Thanks for that. I think it's very clear from what both of you are saying that blended forms of therapy are perfectly fine, and then there's a time and place for all kinds of therapy, provided it is done for the right reasons and done in a professional way. Before we open up for questions. Mahesh, I want to talk to you a little bit about group therapy. Now, that is something which is not really caught on in our country very much. We have self-help groups, we have sort of group education, kind of spaces. But if you look at the West, where actual group therapy is very common, one, because it's very cost effective, it's time effective. At one time, a therapist can work with so many clients, and then you learn so much from each other, and things happen in the group, the processes which can be interpreted. What do you think is there a reluctance? Is it lack of training? Is it that we find it very hard to talk in groups? What do you think could be the reason why group therapies have not taken on in India?
I think there's a sudden burst of groups in offer now in online, especially with like so many younger people offering these groups, for all kinds of reasons under all kinds of names. Either they're actually called groups, or they're called listening circles, or sharing circles, or in many different ways. I think COVID has triggered a change in terms of how people approach group processes in one way. But that said, I think it's also not going to be something which is consistent for much longer. Primarily because I think there's a certain Indianness that comes into that, where we take so much time to open up to one person. And to open up to like 10 strangers at a time is a whole different thing, right? And I think that is one of the most important factors that where whatever we're studying about group therapy, to Indianize it is a lot different, and which is also one reason why names like sharing circle or listening circle works a lot better than calling it group therapy in the Indian context. And speaking of the Indian context again, for your earlier question, I mean, we still have people coming and asking counseling kodtira. There's give counseling, take counseling. So that is the kind of language which is very generally understood. So I am group.
A lot of when you said that, a lot of families would come to me and say, "Aunge counseling ko to convince Madi."
Exactly, and we have families come up like after you discuss with a with a couple counseling scenario, both in each of the couple go to their respective families, pour their heart out about how counselor was like not at all like friendly, everything, and next day you get 5 calls from all the in-laws and uncles to say, how what kind of ideas are you putting into my child's head? You should be convincing the person to stay in the marriage. Why are you encouraging this, etc. All kinds of things are there. But to your specific question on groups, I think it's going to be a while before groups are taken up in that openness. So very specific support spaces like grief-related groups or groups for people who are going through divorce or other things are coming up quite effectively for very short duration, short bursts. I don't know if there has been much success in continuous ongoing groups.
Yeah, thanks, Mahesh. And what you said about sometimes it's almost like pop-up groups coming up for what is needed. So when COVID was there was lots of these listening circles, grief groups and all, which came up, which have kind of almost died down right now. And we will see whether some other kinds of groups come up ultimately. I'm going to stop on that note about the questions from the panel, and we are going to take questions from the audience for the next 30 minutes. Just a request from the audience is that we're not going to be discussing specific clinical cases or scenarios. For that, of course, you can reach out to any of the panelists later, but this is more about what you've heard just now in the process of therapy, or any other elephants in the room that you want to bring up. Please come to the mic and ask your question.
Good evening, ma'am. I was reading an article just last week which said that depression runs in the family. That's one. My question is it so? Second, if someone has gone through depression, can it happen second time also if there are circumstances like some death or some loss of job, etc.? So these are the two questions I have.
Okay, so the question is not directly about psychotherapy, but about sort of mental health
Yes.
in general and depression.
Sure.
So do you want to, Poornima, do you want to respond to? Okay. So, in terms of depression running in families, so depression is a complex disorder and there is no one cause. In fact, when we were discussing this panel, as we were talking about it, there's been a big hoo-ha about this whole article which has come up where a big review has been done in Nature. Nature is sort of our, go-to journal, like the authority, and they have felt that antidepressants really don't work in depression. But then there's been a lot of critique about that actually depression is not just one depression. There are various kinds of depression. So you have one depression which is more biological, which is somatic, which has definite genetic loading. But then there is depression which is related to more physical health problems, maybe, or to disabilities, or to violence happening in the family, or social issues, which it does not run in families. So I think what also has a genetic basis is vulnerability. So it's probably not that everybody in this family where there is a vulnerability will become depressed, but people who have higher vulnerability, if under those difficult circumstances, may develop depression. So it's a balance between vulnerability and protective factors. So one can't really predict. There are models which have been developed, but you can't really predict. To your second question, the more biological, somatic form of depression may recur. But there are many kinds of depression which do not recur. So I don't know whether I've answered your question, but just to say that when we use the term depression, it is basically talking about many kinds of disorders. Thank you.
Hi, my question is picking up on the group therapy part. We know a very champion, I would say, Eric Berne himself used to indulge in a lot of group therapy. And I wish to see that, at least in India, people can start that, and especially therapists who have experience in that space, not necessarily the newer therapists. And that kind of leads me to my next question, is that when we are talking about mental health, I think our treatment are again very closed door. I'm only talking from a treatment perspective. I'm not talking from the client perspective. I'm talking from the counselor or the therapist perspective. I know the treatment can be, but somewhere down the line, we should find an platform where we can share more with the mass, the public, friends, family, and so on and so forth, because it's all about education. And I feel that we should start making it mandatory, especially, ma'am, you come from NIMHANS, that this should be education. This is not about just therapy when you need it, because it's too late. We have to equip people with the right set of knowledge and right set of tools, how they can deal with that situation. And we have to start definitely from, pre-marriage, people expecting having a child, parent having a child, and make sure that they go through that process as part of it. So for me, if you guys can talk about how we can take this as education to the larger mass and specifically to be parents, I think we'll do a wonderful job.
Thank you for that question. I think these are very important issues that you've raised. And we agree that, therapy is just one sort of quasi-closed space. There is a lot that can be done much before that, which can support, help. And many countries are investing a lot of money on, improving parenting, for example, working with prospective parents. And I'm going to ask Dr. Poornima, because there's a lot of work that she does with young people, with university. She's developing a program for IIT students. So maybe you can tell us a little bit about what is going on in that space.
So thank you for the question. First of all, I think it's really very important because if we restrict it to the therapy room, we only touch very few people. But I think that there are some initiatives that are very good already. A lot of schools now have life skills programs, which is really talking about helping people manage emotions, manage relationships, cope with difficulties, and learn that right at the outset. So I think governments across state governments and the central government, they're doing a lot of work with schools and colleges. The other really encouraging thing is that different educational institutions and workplaces have really invested now in mental health and well-being, and they don't look at only referring people to therapy, but also equipping them with various skills, doing different workshops, catching the first signs of vulnerability. But more importantly, what I wanted to speak about is that there are a lot of things that can be done at the level of policy in terms of social structures. So if we are really looking at improving well-being, then what are the laws that can be put into place? How do we deal with poverty? How do we change the educational system? So I think recently in one of the states, they advanced the supplementary exam by a few months. So if you don't clear your final exam, you can do the supplementary within a couple of months rather than having to wait much longer. And they found a significant drop in youth suicides. So what I'm trying to say is that it's at all levels that I think we need to support well-being, and all of that is part of the therapeutic like a therapeutic society or a world that we should live in.
Mahesh, you do a lot of work with corporate clients and, helping them enhance well-being in the
Yeah.
workplace. Would you like to comment on the issue that
No,
was
no,
raised?
very similar things like what Poornima was talking about, that corporates, more and more corporates are investing a lot, asking for workshops, asking for different kinds of interventions. Asking for general conversations on mental health, not even like, very specific things of like, okay, talk about ABC things. That's happening on one side. I also absolutely agree with Poornima, that there needs to be a certain degree of like policy and other activism, because the context that we live in is what impacts mental health so much. Like for a person with disability, not having accessibility is crucial to their mental health, and if we don't support it, that's important. And like recently, DMK MP in the parliament, Tamilachi raised this issue of how the government has actually kind of discriminated against the LGBT community, actively, stopped rights for the LGBT community related to surrogacy, adoption, and many other issues. So if you don't talk about those things, then the whole community is going to stay this with. Parenting needs deprived and other things. So mental health people, it's about educating on one side. It's also about like advocating on another side with governmental agencies and educational institutions and everybody. So
Yeah, I
yeah,
mean,
important.
important because I think, one of the things that, for example, has shown a direct correlation with mental health is green spaces. And there's a lot of talk about how green spaces are very therapeutic for mental health, regardless of your diagnosis. You could have schizophrenia, depression, or just a mild form of problem, but having green space. And we know that all our green spaces are gradually going away. And if an older person wants to take a walk, there is no place for them to actually go out. A park was a place where people would meet each other. For example, in Africa, there is this very useful evidence-based intervention, which is a very simple intervention, and it's called the friendship bench. And it's been replicated in many countries around the world now, that the friendship bench is basically a bench which is available in public spaces and they have trained women in the community and other men in the community to actually give very simple counseling kind of support. And that seems to have improved the mental health of that community where you had these friendship benches. So I think there are simple solutions which can be done. And like the question was asked, it doesn't necessarily, everything doesn't have to be some kind of intensive therapy. That is probably for a certain group of people. But completely agree that when we're talking about mental health, it often ends up even among policymakers that you ask a psychiatrist or a psychologist to be in the group, rather than to actually look at environment, to look at economic stability, to look at violence against women and all other aspects that each of you mentioned, including parenting. So I think, absolutely, I think all of these things are very important. More questions?
Good evening. I want to know if marriage is a good therapy for somebody who is suffering from psychosis. So, you know, I think you're from Niman, so you know about it.
What do you
and,
think?
Uh, so that's why I want to ask Poornima ma'am. She told uh, the personal human interaction and that care and touch is very important to deal with such people. And also, ma'am, you said, two people need to be open with each other to be able to get better of, for one another or each other. So that's why I would like to know if marriage is a good therapy for person who's suffering from psychosis, because I feel there would be a close interaction, or maybe not. Hiring a nurse also could be a therapy. So what do you think?
Ratna, I think maybe you can take this. You made that comment, so.
Yeah, I think a good marriage is a wonderful thing, regardless of whether you have a diagnosis, don't have a diagnosis. Good therapy is a wonderful thing, but the two are not the same. In practical experience, I do know that many times parents often feel that, okay, you know, if I have a son with this problem, I get him married, he'll be fine. And however, there are lots of factors which are involved in a marriage. And often this is seen from the perspective of if a boy with a problem gets married, his wife will look after him. I would wonder what happens to women with problems. Would their husbands look after them in the same way or not? So yes, I think in brief, I have definitely seen, regardless of diagnosis, schizophrenia or not, you can have a good marriage. A diagnosis doesn't mean that you cannot be a partner to someone. But I think it's very important that both partners are very aware of what they are getting into before they get into it. And, you know, you might hear that this is what a person has, but unless you actually spend time with them and interact with them, you may not know exactly what it is that you're signing on for. And sometimes it can happen that people get married, but then find that they can't quite cope with the marriage because, I mean, for all of you who are married, you know, marriage is a fairly demanding space. And it's not necessarily something which is easy to cope with, and that can make it worse. So I hope I kind of responded to that.
Thank you.
Okay, hi. Thank you so much for that talk. I'm really one of those you talked about, which is that over 60s and 70s, and with pressure from the family to go see a psychiatrist or a psychologist, counselor, I would say. I recently recovered from cancer, and I was trying to rule out all the possibilities of getting it again. So there's a physical aspect to it, there's a genetic aspect to it, and there's a mental aspect to it. So I'm trying to sort of wrap up everything. And I was just wondering, I've had a very comfortable life, I have to say, and nothing to sort of complain about. But is there something in a subconscious level that I'm not aware of that is troubling me? And is that something that I can get help with?
Poornima, would you like to come?
Okay, so I'll start out, but of course, anyone else can also add. So the thing is that any of us who enter therapy, it depends what we're looking for. If we're looking at it as something to dig out some troubles that we're not aware of, that's one thing. The other is to see it as a space where you have someone maybe as a sounding board, you have a space to connect some dots for yourself, or you have a space where you find yourself expressing something in some way that you that is helpful for you. So I think therapy is a very big playing field.
Mhm.
And so if you go there, you may find something that is helpful for you, but it need not necessarily be to find some problem or trouble, or
Right.
it can be just a space for growth.
Mhm.
It can be a space for you to just reaffirm something you already know about yourself and
Okay.
hear it in another way. So,
Okay.
so
All
I
right.
think therapy is like a pretty big space, and you can enter it and explore it whichever way.
Okay.
you find
I
meaningful.
think I've got my answer. Thank you so much.
Good evening. Good evening to all. So, therapy, as in a society, it has a bit of stigma attached to it. I, being from a middle class family, my parents are, kind of against it. And I'm a student. I really can't afford much of the traditional therapies that are available. So, how can I, as a student, access therapy in a way that is convenient to me? That was my question.
Okay. I'm going to ask Mahesh and then Poornima.
I think there are people who are counselors available at any kind of price point. Even as a student, if you're able to afford like even like say 200, 500, you will possibly find a counselor willing to work with you at that price point. But it does mean that you have to ask, you have to kind of like, take that chance to open up and ask in any counselor that you find. Most of us have connections to multiple different networks, and if we cannot meet you at the particular price point or the particular timings that you want, we usually kind of like put it to a wider network to see who might be able to help you out in that particular context. So affordable counseling, accessible counseling is available, but it means that you need to also be able to kind of take that first step of approaching a single person to put your query across.
Poornima, I'm also asking you to support her a little bit, or some reflection on what she was saying, that my parents are not very sort of whatever keen on this therapy, or so she it's that point is also difficult for you.
Yeah.
Would you like to address that?
So when a lot of young people seek therapy, they would sometimes like the support of their parents, not just financially, but to feel that this is also you're with me, or you're sort of with me in the process. So sometimes it can help to have a conversation, or maybe if you're able to take the first step and then continue the conversation with them. But sometimes as a young person, you might need to take the step on your own. And your parents may not be with you right in the beginning, but if you get back to them later, share some of your experiences or bring it up later, you may find that they join you in the process. Otherwise, it can become sometimes a barrier to you taking that first step itself. I also wanted to add to what Mahesh said, that if you reach out to one person in the network of counselors and therapists, you'll often find that they'll help you, because many therapists will have some space that they keep to offer therapy at reduced rates. There are also several organizations. I think the problem in our country is that we don't have one space for someone to just, log in somewhere and find the resource. For example, at NIMHANS itself, we have an urban community center called the NIMHANS Center for Wellbeing. The rates are really very, very nominal. The process is very easy. You just have to pick up the phone
Okay.
and you will get an appointment.
Thank you so much for providing a starting point for me. Thank you.
Thanks for talking about it openly. Yeah.
So thank you for organizing this in the first place. So my question is even if somebody who doesn't have any stigma attached to mental wealth want to reach out to a good therapist, and as you were talking about that these are the qualities I would look when I'm suggesting a therapist to a friend, but to a common man, how will they filter out among the list of doctors? I've recently shifted here. I've been struggling to find a good therapist, and there's no urgency for it, but I'm just not able to have the right filters, because maybe all the information I find is the designation, the qualification that the therapist holds, or the number of years of experience. Having taken therapy myself in college with someone very little experience, but very effective. So I do feel that I can't. And since, as we talked about that, yes, not everybody can afford to experiment. And since it's a long process, by the time I realize this relationship with my therapist is not working out, I think it's too late and might add more anxiety to me than I had before that, okay, I have to repeat the process. So how do you think we solve that out? For somebody who has no experience, how to reach out and what kind of a person therapist is right for them?
Yeah, that's a great question. In fact, whenever people come in for therapy, I always tell them it's taken you a lot of courage to reach here.
Yeah.
Because you're making yourself vulnerable to another person. There's so much, it's not very easy to enter that, to find somebody and to go. So maybe I'm going to ask Rathna if you would like to, respond to this. How do you
Figure
find the
out.
therapist?
Yeah, I mean, I think that this is actually right now the biggest barrier to people seeking therapy. We have several people, more people than most ever before, who are quite willing to embark on this, but finding somebody is not that easy. So again, some therapists have online presence. You can get to know a little bit about them. This is still India, so word of mouth is still the most trusted route
But
for most people.
But the problem there is people don't talk about therapy. Like when I was taking a therapy in college, if I go and tell someone else, okay, Thursdays is my therapy Thursdays, people will be like, oh, what happened with you? Like they'll be overly concerned. So I think people, most of them, now I can freely talk about it. So that's the thing. The word of mouth is also missing, I guess. And we're just experimenting.
It is. I mean, I think I can just say I empathize with you, and I know that it's a difficult thing. But the more forums like this we have, the more you speak about your experiences. And I can see that in social media and thing, while there are some things which are a little disturbing, it is also definitely a space where people are willing to share their experiences. And you might get some clues from there. In private practice, very often, before you fix the appointment, you get to speak to the therapist. And I do know that many clients want to have a phone conversation first to say, no, I want to know what do you work? This is what my problem is. Do you think this is something that will be okay? And me, and I think quite a few therapists are quite okay with that. So that initial phone conversation could be one way in which you just get a sense of the other person without necessarily making the investment of committing to, a session or so. And that might be one slightly in between place which you could use.
Just one thing I can add there maybe is that I see people using Reddit and Quora to check on who's around, what's available, and even for specific reviews about one person, and crowdsourcing such information which doesn't require you to reveal too much about yourself may also be a way of cross-referencing things. Though I have also learned that reviews on Google or anything else may not necessarily be the best source of information. It's not the reviews you should look at, but maybe crowdsourced information, on Reddit or Quora or whatever else is your preferred choice of platform.
Thank you.
I think we didn't really give you a complete solution, but several paths to figure it out.
Yeah. At least now I'm sure I can just have a free phone call with my therapist. I thought it could be a breach of like not going there and just inquiring about their work. So I was not very confident about doing that. But yeah, I think I'll try it with the next person I reach out to. Thank you.
We probably have time for one question. 3 more people? Okay. Yeah.
Hello, good evening. My question is specific to the fear of going to therapy, and specifically, I read a research article very recently. I came across one about shamanism, and this has to do with somewhere in Africa where people who are diagnosed with schizophrenia, right? So there they tend to kind of establish a much more positive experience with their voices, unlike our society where it kinds of tells schizophrenics that you're not supposed to be hearing voices. They're hallucinations. They don't exist, right? So kind of by labeling people or diagnosing them, So it's kind of limiting their own, consciousness, I would say. And my fear of going to therapy, in fact, started from there, where I don't want to go to therapy, specifically where I'm looking for diagnosis, get diagnosed, and then have my entire identity kind of, defined by the mental, diagnosis, mental illness diagnosis that I get from that. Right. So that's one of the fears that I have currently. So I'm battling with that, and I would like to know how I can probably approach it.
I think that's a very, very good question because, how do therapists do they work with the diagnosis or do they work with the person regardless of the diagnosis? And I think that's something that was a question that I did want to ask the panelists because, traditionally therapy doesn't really go exactly with diagnosis or doesn't make you get that identity, but I'm going to ask Poornima to discuss this.
So I think to some extent it will also depend on the kind of setting that you're going to. If you're coming to a hospital setting, let's say a mental health hospital setting, you may find that there are files, there are diagnoses made, and that's the lens through which, you need to enter. Having said that, even in a setup like that, once you connect with the therapist, you may find that they're really not relating to you with that label, but more as a person, what you bring in, what you're looking for. And mostly therapy is about emotions, about ourselves, and about our relationships. So you may find that even in those setups, and I think a lot in the therapist and counselor community, there's a growing understanding that this can be a barrier, that this can be difficult. And so many therapists and counselors will have that conversation, put that diagnosis to the side and really relate to you as a human being. I can't say that could be your experience with anyone whose door you knock on, but increasingly, I think this is, something that therapists are also very, very conscious about and are trying to, respond to.
Does it answer your question?
Yes. I guess I'll have to seek out therapy where I'm not specifically looking for a diagnosis. But
And you could have this conversation with the therapist also, that this is something on my mind and this is something, because then that opens up.
Thank you.
Good evening. You were talking about this whole science, which is brought into India from the West. But I just want to say that we have a wealth of information already in India, which we haven't talked about at all. My own experience is, this information that I'm talking about is how to live your life. Okay, now if you understand how to live your life through this information, I'm talking about spirituality, I'm talking about the Vedas, the Gitas. If you know how to live your life, you won't stumble and require this kind of help. So I think we need to have a look at that part of it also. The information is right here, and we bring this science from the West, and we try and use that as a solution to a problem that was created because we don't know how to live our life.
Thank you for that comment. In fact, that's one of the reasons why we discuss the cultural issues. And I think a lot of the therapists actually bring in, spirituality, discuss spirituality and what works for that particular person. I think it's also about everybody is not going to want to go that path. There are people who are already, into spirituality, whichever religion it is, derive their strength from that, and would like to work around it. So I think it's about accepting that there are things in our culture which are very useful, which are therapeutic, using them for people for whom it works. It works for some people. It may not appeal to everybody. So I think it's about making those choices. In fact, like they say, Krishna was the biggest counselor kind of a thing that, if you read Bhagavad Gita, there are things that are there which are very, very useful ways of coping. And many Western philosophers have used not just the Gita, but many other spiritual books, including Rumi's philosophy and other forms. So I think it's about learning from various kinds of schools and using these based on the client, their needs and what works for each person. So I agree with you, and yet we really need to match it with the person who comes in front of us.
Yeah, I'd like to add that I think it's very important to understand that therapy is never something that can be or should be imposed on anyone. It's always a choice. And there are many people who don't actually need therapy, who found other ways to live, who, as you say, have figured out how to live their lives in such a way which is good for them. And I mean, I think that's absolutely great. There are some people who continue to struggle for whatever reason, and some of the people who struggle feel drawn to this particular way of working with things. And for those people, there is therapy. For people who find other ways more useful, maybe starting yoga and a meditation practice is actually going to help you enough that you don't need further help. And I think, it's a big world and there are lots of people and everyone is sort of free to choose their path. So the idea of sort of plurality over there, I think, is important.
Like the both and kind of approach rather than the either or sort of approach.
Last question.
So I intentionally kept the question last because I have one for Rathna, one for Mahesh sir, and no,
Allowed to ask.
and one for the entire panel to address it, like in a general sense. So first question is addressed to Rathna, which is about when you talk about therapist characteristics. So you touched upon empathy, openness, and certain kind of non-judgmental characteristics, or anything that is that your specific client won't feel like it's I should be prejudiced about the therapist to whom I'm visiting. So what about the kind of characteristics that have, for example, like a certain sense of assertiveness, certain sense of dominance? Because what I feel is, or maybe from my experience of going to a therapy, not everyone would require a very agreeable therapist. Rather, they would require someone who is very assertive, who nips the bud in the rear, like very easily at the point where, and also requires a level of saying that this is what it is, because without even sounding too agreeable or too, I would like to, I hope you understand the context behind what I'm saying. So I would like to.
So how directive should a therapist be?
Yes.
So I think directive is not the word I would choose, but a therapist has to be brave. I think that's how I would put it, because brave and, let's say, confident enough in what they're doing and what they're saying, that some of that does get communicated to the client. So when I say open, I don't mean a therapist who will just say, whatever you're doing is fine, keep on doing this, you are good, and not actually challenge you at all. So I do think that challenging the way in which a person is living is a large part of therapy, because obviously there's something about it which is not working for them, which is why they're here and they want to know what could work better. All I meant is a therapist who helps you to find your solution rather than telling you what the solution ought to be. It's the difference between give a man a fish and teach him how to fish. And that's really all that's about.
And for you, Mahesh, and the thing is, when we were talking about group, when the panel was addressing about group therapy and everything, you mentioned that young people, especially young people, use Reddit, Quora, or any sorts of location-based social media apps to check out the kind of therapist credibility, like what kind of people they can go to. And this is especially for group therapy. So my question is, just in case to help them, are there, and also someone who is talking about, is there any sort of affordable ways of affordable ways of doing it? So I wanted to ask about the kind of pro bono work therapeutic communities like do. Say, for example, I'd like to quote Hibiscus Foundation also, if at all you guys know. But I mean, are pro bono work available in India? It's
Mahesh, would you like?
Sure, and I think there are pretty much most counselors I know have some degree of pro bono work that they plan for in their lives. It could be about 15 to 20% of their capacity to work. That is one part of it. There are organizations which do pro bono work, but I personally feel that there needs to be a certain degree of like value exchange that a client feels that they are valuing the counseling process and pay whatever they can, even if it's like 10 rupees, 100 rupees, or like a bushel of like wheat, or like two heads of garlic. Anything is fine. And but I believe like that exchange allows the client to feel a certain parity with the counselor, that what I have given something of value, taken something of value in that sense. So, but yeah, there are enough people around. Please ask. There are, I don't know Hibiscus Foundation myself, but there are many other places, including populations that work with working class groups, especially with the LGBT community. We have quite a few pro bono services available.
I think that answers my question.
Thank you very much. And I think, it's been such a great discussion. Thank you to all the panelists, Mahesh, Rathna, and Poornima. And thanks to the audience for asking us very interesting and challenging questions and being very open about yourselves. It takes a lot of courage to come to this mic and talk about your own, quest for understanding yourself. Thanks to BIC for allowing us to have this panel. Thank you.